thank you all for taking the time to come out and share your thoughts with us and to learn something about where we are in the county in addressing this issue of monkeypox and containing its spread and keeping us all safe in the county. I am the director of the Department of Health and Human Services, and on behalf of the county executive and the leadership of Montgomery County government, I want to welcome you to this town hall. I greatly appreciate the partnership that we have had with Council Vice President Glass in organizing this event. And I know that not only Councilmember Glass, but all of the members of the County Council, as well as our Maryland state representatives and our federal representatives, are fully engaged in doing all we can to protect our residents and doing more than we have to this point in trying to get the resources in place to keep us safe and protected. We know there's a lot of concern in the community about this reemerging disease that was first identified in May of this year in the United States. And while there are a lot of questions, I want to assure you that the staff of Montgomery County Department of Health and Human Services is working in partnership with the LGBTQ plus organizations in the community, and we are together doing everything we can to respond to this. There clearly have been some hiccups along the way, especially with the speed at which this vaccine has been rolled out. And we are continuing to work with our healthcare partners at the state and federal and regional partners to respond to this and to continue speaking loud and clear about the resources we need. Council Vice President Glass has already put out a call to Governor Hogan to get us the vaccines that we need. The state and the federal government are working to try to change the way how the vaccines are distributed and how they can be administered to give us greater capacity to get vaccinations done in Montgomery County. This is the first of what we expect will be a series of town hall meetings, and we will continue to host them and to share information with you as long as there's any risk to our residents. I think our team tonight will share with you the risks, who can get monkeypox, how it's spread, how you can protect yourselves and keep yourselves safe, and how and when you can expect to be able to be vaccinated in the county. There are some differences that Councilmember Glass alluded to between DC and state of Maryland. That should not be a reason for us not to get the vaccines that we need. We will put them in place as quickly as we can. We are working both to make sure that we are preventing the spread by identifying communities where the virus is attacking us and making sure that they are prioritized. Those communities are prioritized first as in terms of the eligibility for vaccines. I am also mindful of the history associated with and the stigma associated with diseases that sometimes spread in the LGBTQ plus community. I lived through with family members and friends the HIV pandemic or epidemic and saw firsthand the ways in which the community was mistreated. I want to assure you that is the last thing on anybody's mind is allowing that to happen. We will not tolerate the stigma or discrimination or bias in this process, and we will work to do as we did with rolling out the COVID vaccines to make sure that they are equitably distributed and available, and that they are available to people who are at greatest risk.